Hi, I'm Dr. Robert Glasgold.
Hi, I'm Dr. Mark Glasgold.
And together,
we are the Brothers Glasgold.
As a general rule of thumb, we would normally recommend waiting approximately 1 year from the original surgery before revising it. That being said, if you're dissatisfied with it, you don't have to wait a year before coming in. And sometimes if it's more minor things, there are interventions that can be made sooner than a year out. So from that perspective, it's worth having the discussion before the year is up. But a lot of it, for a major revision, usually we're talking about 1 year before doing it.
So I've been doing fat transfers to the face since about late 90s, 97 or something like that. So it's 20-year follow-up. And there aren't that many. I do have a couple of patients that have like 18, 15-year follow-up who still have maintained good volume. There are a lot of reasons why people don't think fat transfers last a long time. Some of it is understanding what happens when you do a fat transfer. So when you do a fat transfer, people look really swollen and really full. And then about 2 months after the procedure, they love the way they look, but they're still looking a lot at swelling. Then about 6 months after the procedure, they're going to look at their face and they go, I don't see that much difference. It seems like all the fat went away. And then about a year after the fat transfer, is when you really start seeing the full results. And I think it takes a good 2 years to really fill out. So a fat transfer is a long-term commitment, but you do get very long-term results.
At about a year, you have a really good idea of this is what's going to be there and should continue to stay. One of the variables, though, is just with age, you're going to have volume changes in the face, so you're going to thin out more. So someone who is maybe a younger person who wants more cheek augmentation, they're going to see changes in their cheek volume just with natural age. There's no way to stop the aging process as it relates to volume changes. Or people that they work out a lot, especially as they're getting older and are more committed to a workout regimen, their face is going to thin out a little bit more. So those play into what is the long-term result going to be. But definitely we've seen people greater than 10 years commonly where they still have good volume augmentation from the fat transfer.
Yeah. The other thing is people are doing fat transfers a lot of times for the wrong areas. So they're doing them for nasolabial folds or smile lines or lips. And so you don't really see good, if you would, take or correction. Those are areas that respond much better to fillers. Even long-term correction, you do much better with off-the-shelf fillers. Fat transfer is really for global volume loss. It's for addressing a face that has lost a lot of volume. It's much, I think, more effective in treating people who are having aging face issues than maybe people who are trying to sort of change the way their face is looking.
There's huge dissatisfaction with filling nasolabial fold or smile lines and lips because the amount of change usually you want is a very precise, subtle amount. And fat is not necessarily, doesn't give that kind of precision because it's a thicker material, you're putting in the thicker material, a certain percentage of it is staying, a certain percentage of it is resorbing. So when you're trying to get this very precise change in a fine line, you're setting yourself up for disappointment. So we'll usually, if someone comes in with the idea that they want to do lips or lines with fat, we'll steer them in a different direction and go towards injectable fillers.
This goes into a topic that I think is important to discuss, which is how long do off-the-shelf fillers last? And it's a very sort of broad question, but we only inject hyaluronic acid fillers. So that's going to be Allergan products, which are Juvederm and Voluma, or Galderma products, which are Restylane and Refine and Define. But the hyaluronic acid products are temporary. People say, well, how long do they last? The only claim that these companies can make is what they went through their FDA studies with. So the original FDA studies were all 6 months, so you can say they last for 6 months. For Voluma, they did a 1-year study, so now they say Voluma lasts for 1 year. Our experience is these products last for many years often. And that there are a lot of patients I see who are getting injections every 6 months for years in the same area, and they're getting overfilled in a single area because the product doesn't go away, it just lasts and stays. So there's a lot that's being done with hyaluronic acids. Our practice has really gone probably from the workhorse being fat transfer to the workhorse being fillers, off-the-shelf fillers, hyaluronic acid. And fat transfer is more of a specialized procedure. We do it a lot when we're doing lower eyelid blepharoplasty or upper eyelid surgery or aging face surgery. But for sort of standalone volume rejuvenation, we've really shifted a lot to the hyaluronic acids. So there's two different things that Botox is really good at doing. The best thing that Botox is really good at improving is changing affect. Affect is the way that other people perceive your face. So, for example, RBF is affect, is how other people perceive your face. And you can take someone who has a very stern RBF kind of face and with Botox soften their face. And so in that case, you might have someone who's relatively young who's going to really benefit from Botox because the way people are perceiving them is not maybe who they are inside. The other is in treating wrinkles, and it's very effective for crow's feet, for frown lines, here the 11s, for preventing them from getting deep. The place that we see Botox being misused the most is people trying to get brow lifts. And so what you're trying to do is manipulate people's eyebrows to give them the appearance of a brow lift. You are injecting, well, let's take a step back. So there's a big square muscle here, and if I inject that, if I flex that muscle, I get wrinkles in my forehead, lines in my forehead, and I lift my eyebrows up. Now if I put Botox in that muscle, the lines are going to go away, and my eyebrows are going to come down. So what people are doing to get a Botox brow lift is they inject some Botox in the central part of the forehead, so the inner brow comes down. They don't do anything in the outer, so the outer brow comes up, and your brows do go up, but it almost invariably looks like this bizarre Spock kind of appearance. So I would say 90% of the people who come to me for forehead lines, I just tell them that, you know, the look you're going to get from Botox is going to be worse than just leaving it alone. Because what you're going to do, if you inject forehead lines, you're always going to drop eyebrows. You can't do it without dropping eyebrows.
That being said, you could taper the result a little bit, you could soften it, you could do things, but that's the area of greatest dissatisfaction with Botox from patients. Coming back to the question, which was when to start, there isn't a right answer. I would say a lot of people are starting in their 30s. One thing, it definitely makes sense to do it before you have very deep ingrained lines, because if you come in and you're 16, you have these deep lines or furrows in your glabella or frown area, the chances of us making it so it looks real smooth are not as great as if you come in and they're not quite as ingrained, and you could essentially smooth out the skin, and once the skin is young enough and elastic enough that you stop movement and it really remodels and resets and looks good again. But some people are just not going to come in at that time, and they'll come in later and they'll get improvement. It's not going to be the same degree of a long-term result as you get when you start a little bit younger.
So that also depends on your skin type. If you have sort of thick, heavy, oily skin, you're not going to get wrinkly as quick. If you have sort of very thin, fine skin, you're going to benefit more probably from doing Botox earlier.
Yes, non-surgical. I'll do non-surgical rhinoplasties. It's not a big part of what I do because there's limits what you can do. Essentially, you're trying to reshape the nose by injecting around that sort of base shape. And so if someone has a bump on their nose, you can build it up. If it's a crooked nose, you can fill in one side and straighten it. But I find that most people don't just want a bigger nose that is camouflaging a bump or a wider nose that's camouflaging a crooked nose. They want a straighter, more narrow nose, where they want a nicer profile line without not just camouflaging the bump, but really restructuring the whole nose. So more often I'm talking to people about doing surgical rhinoplasty because you're going to get a lot more out of it. There's definitely a role for it. I just think it's there's a more limited number of people that are going to be good candidates that are going to get the kind of result with just injections. The right age is a combination of the patient desiring the changes in jawline and jowl and neck, because that's what a facelift is going to change, and them having the signs that we're going to be able to make a change, meaning they have some jowl, they have some neck laxity. When is the best result is actually earlier rather than later. So when people come in and they're 70 years old and they tend to have not as great skin and there's more skin hanging, you definitely get an improvement and they can look great. But if someone's got a little bit younger skin, they get a better result. They age in some ways in a more natural progression, because you're not going to this sort of waiting till you're all of a sudden much older and then trying to set things back. So it's a more natural progression, and you're benefiting from it longer. So a lot of people say, well, why do I want to wait till I'm 70 to start looking young again when I can get on top of it a little bit earlier? But ultimately it's going to, those things being said, in my opinion, it still comes down to the individual, the patient, and are they ready to go ahead with that, and are those things bothering them at that point that they're ready to do it?
So I agree completely with Rob. I would put a little bit of a different viewpoint on it. When I started doing facelifts, I was really concerned with having really noticeable dramatic results in patients. So I liked doing them in older patients because they would get such a big change. But like Rob said, it's a little bit harder to control a lot of lax skin and keep it natural looking. We can do it, but a lot of times when you see facelifts out there that look all weird, it's because the surgeons just pulled and people will take necklines and put them up onto the face, or they'll pull a lower face on a mid face, so it's harder to keep it balanced. But you can do it, and there's no reason. We do facelifts into the 80s, so there's no reason not to do them. We have tremendous patient satisfaction. The change has been really towards younger facelifts. So if someone would come in before 50, I would often resist them. Now, if someone's coming in 48, 49, and they have some noticeable laxity, even if they're not going to show that much difference in a before and after picture, I've just found following them that, if you do a facelift like late 40s, early 50s, it just holds up so well. And, you get to be in 60 and you don't really look like you've changed very much. And then, some women will continue and do another facelift sometime in their 60s, or some women are just happy because they've just gotten so much mileage. But you definitely get more mileage when you do it younger.
Yeah, I think with those, especially as that skin loses elasticity and there's a lot of neck skin and pulling it back, those patients tend to get a little bit more chance of some skin recurrence or laxity that persists there. Or better textured skin, a little bit younger, you just tend to get a nicer result.
Yeah, and then also when you start young, the revisions, when you say you do your first facelift at 50 and you do another one at 62, it's just sort of like things aren't really changing very much. You're just sort of gliding from 50 to 70 with very little facial change. It's just nice.